Welcome to WeRPN's Self-Care e-learning module on anxiety. Before we begin, we ask that if you're currently in serious mental distress, please immediately reach out to a healthcare professional for support. The following presentation is meant to assist nurses in coping with anxiety, but in no way replaces the need for medical professionals or any prescribed treatments you may require. Admitting to needing help is not a poor reflection on your skills or abilities, and in no way questions your ability to continue as a nurse. Self-reflection and improvement is all part of the professional requirements through the College of Nurses. Having the insight to seek out medical attention and recognizing the need for help in coping shows your unwavering strength and dedication. It's okay to not be okay. Today, we'll be discussing the definition of anxiety, some of the different types of anxiety, how anxiety can present, how COVID-19 has impacted anxieties, how to recognize when intervention is required, healthy coping mechanisms, self-care tips, and finally, some apps we've already reviewed that can assist you in achieving some stress relief and a reduction in anxiety. Anxiety is described in the Merriam-Webster Medical Dictionary as an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs, by doubt concerning the reality and nature of the threat, and by self-doubt about one's capacity to cope with it. Everyone experiences symptoms of anxiety, but these are generally occasional and short-lived events and do not cause ongoing or long-lasting problems. But when the cognitive, physical, and behavioral symptoms of anxiety are persistent and severe, and anxiety causes distress in a person's life to the point that it negatively affects his or her ability to work or study, socialize, and manage daily tasks, it may be beyond the normal range. There are many types of anxiety, and they may affect each of us differently. People with anxiety disorders may feel anxious most of the time, or for brief, intense episodes, which may occur for no apparent reason. They may have anxious feelings that are so uncomfortable that they avoid daily routines and activities that may cause these feelings. Some people have occasional anxiety attacks so intense that they are terrified or immobilized. These are all signs of anxiety, and they are normal reactions to stressful, difficult, or dangerous situations. Anxiety becomes an issue or problem if these signs of anxiety occur without any obvious cause, if the reaction is greater than a situation calls for, or if these anxious feelings interfere with your ability to function or cope in your day-to-day life. Take a minute to assess where you're based on the characteristics on the screen. If you feel you're exhibiting one or more of these, or it occurs frequently, it may be time to refocus and/or reach out for help. Self-reflection can be hard, and sometimes it takes someone to point out that we're not okay before we can recognize or process this ourselves. How does COVID-19 impact anxieties? The pandemic resulted in nurses experiencing greater pressures in the work environment. As more information about COVID-19 became available and more was known about the disease, directives changed, and this created more uncertainty in healthcare. Nurses also reported working longer hours or more shifts due to staff shortages. These type of stressors create anxiety for nurses. That results in concerns about contracting or spreading the virus to their families. Sometimes, just the thought of what could happen is enough to send people into a crippling state, as some believe the unknown is worse. Mask anxiety. Nurses understand the importance for PPE, but masks can make people feel claustrophobic, dizzy, and for those with glasses, they can become fogged. This creates a sense of being overwhelmed or ill-equipped to do the job. It's hard to nurse if you can't see. Masks are also a physical and visual representation of a state of emergency. This can furthermore contribute to anxiety. Wearing PPE can also contribute to a risk for poor hydration. During a pandemic state, workstations are often kept free of unnecessary items, and this may include water containers. Nurses are aware of the risk of removing PPE to take a drink, and leaving the work environment to properly hydrate can often be difficult. In some cases, a lack of proper PPE is a concern that was identified at the onset of COVID-19 outbreak. Reusing masks and the threat of completely running out of PPE was a frightening reality in practice. Nurses in some areas felt high levels of moral distress, in part related to the changing way care was delivered. Teams were required to make treatment and care decisions to address the greater good of all patients, with limited resources to meet their needs. COVID-19 created more stressors in nurses' daily lives and impacted their well-being negatively. This demonstrates why self-care and coping strategies are imperative during times of stress. Making time to care for ourselves can be challenging at the best of times, and was identified as even more essential during the COVID-19 pandemic by Anxiety Canada. Exercise is one of the best ways to reduce anxiety and lower stress, and is as important as rest and sleep. Making sure you get a good night's sleep helps the body and mind reset. Review the WeRPN self-care module for more information about physical self-care. There are suggestions for ways to improve exercise, relations, and sleep. Understanding what and how you experience anxiety is helpful to controlling it. Watch out for things that can initiate anxious moments and learn how to reduce or control these triggers. It will help you to keep your anxiety under control. Refraining from self-medication with drugs or alcohol is crucial, as these activities can help your anxiety worsen and negatively add to the issues you're experiencing. Taking time for yourself by doing the things you enjoy will help lessen your anxiety. Meditation and volunteering are two examples of ways to engage in meaningful experiences. For some, their anxiety can be a symptom of post-traumatic stress disorder, or PTSD, and may require more intense and professional assistance. Prolonged exposure therapy with a trained professional is one way you can work through the harmful memories or experiences to better understand what you're feeling. And finally, becoming mindful allows you to focus on the present and what's happening around you. By paying attention to your body and your surroundings in the moment, it will help you reduce anxious thought. By practicing stop during stressful moments and throughout the day, you can gain perspective of the situation and empower yourself to respond to the situation in a calm manner. S means stop and take a moment away from the situation. T is for take a breath. O is for observe what is happening around you. And P reminds you to proceed with a helpful action. Sometimes you just need to stop what you're doing, and taking this break will help you see things more clearly. The PTSD Association of Canada has developed the following strategy for coping with COVID-19. This strategy can also be used when experiencing anxiety. F means focus on what's in your control. The first step is to focus on our behavior, as that is something we can control. Responding effectively to this crisis means acknowledging our thoughts and feelings about what's going on and behaving in a positive, constructive way. This is achieved by following the next 3 steps, A, C, and E. A, acknowledge your thoughts and feelings. The goal is to recognize that you're feeling or thinking a certain way. Don't try and ignore it. Examples of this would be, I'm feeling sad, or I'm worrying again. C, come back into your body. Focus on your body and the control you have over it. Keep acknowledging your thoughts and feelings, but begin to connect with your body and move it. Examples of this would be sitting up straight in your chair, pressing your fingertips together, stretching your arms, slowing your breathing. E, engage in what you're doing. Focus your attention on the task at hand and recognize where you are. This can be achieved by identifying 5 things around you or 4 things you can hear. Finish this exercise by paying full attention to the activity you're doing. It's recommended that you complete the ACE portion slowly 3 or 4 times to make it a 2 to 3 minute exercise. Now for COVID, C means committed action. This step is guided by your core values and is an action you take because it's truly important to you. Ask yourself what you can do to help yourself, others you know, and those you live with. No matter how small the action is, a quick phone call to a friend, taking a walk, or running an errand for someone who can't, give it your full attention. O, opening up. Acknowledge your feelings and that they are normal. Practice self-kindness and give yourself permission to feel the way you do. V, values. Find a way to incorporate your values into your day. These may include love, respect, humor, patience, or courage, to name a few. I, identify resources. Utilize a reliable source to get updated information on the pandemic, like the World Health Organization website or your local government website. Identify family, friends, or health professionals that can be supportive in your life and that you can provide support to. Finally, utilize social media for support options. D, disinfect and distance physically. Practice good hand hygiene regularly and social distance as best you can.